Good morning, everyone. My name is Dr. Ankur. I am Chief Physiotherapist at Wellness Physiotherapy Clinic, Delhi. And today I will be presenting on topic infectious disorders of bone and joints. Now, any inflammation of bone caused by any infection is known as osteomyelitis. It's mainly caused by bloodborne infection, modes of transmission. We can say it's bloodborne, contiguity, or any direct invasion through an open wound or inoculation. Now, osteomyelitis is mainly of three types: acute hematogenous osteomyelitis, subacute osteomyelitis, and chronic osteomyelitis. It is there are some more types, but we'll discuss them about later. Now, first we'll discuss about acute hematogenous osteomyelitis. It is mainly by bloodborne. This infection is mainly caused by bloodborne organisms. Children are the most commonly affected. The the organism which causes this mainly is Staphylococcus aureus. The infection site, it is mainly at the metaphysis of the long bones. Long-term morbidity is more than 25%. Now, for the pathology part of this acute hematogenous osteomyelitis, pathology is inflammation, suppuration, necrosis occurs at the site of infection, and when this necrosis occurs, new bone forms which is uneven in shape, which further results in problem for the growth. Okay, and the clinical findings we'll find is pain, fever, inflammation, loss of function, and soft tissue abscess. Now, for the radiographic findings, when we'll do an X-ray, we'll find soft tissue swelling, demineralization if the X-ray has been taken after 10 to 14 days, sequestrum and involucrum, which will be found later. Okay, how to confirm this through lab findings? We could see for elevated WBC count, elevated ESR, and CRP. Blood culture would be positive for infection. Now, for treatment part, antibiotics are given, immobilization is provided, and in major cases in which infection has progressed, surgical drainage is necessary. Surgical drainage is done to remove abscess, and also debridement of the infected tissues is done. And in cases of failure of non-operative treatments, the most common cause of this acute hematogenous osteomyelitis is because of an organism called Staphylococcus aureus. It's the most common organism. It infects newborns, children, and adults equally. But besides them, some other organisms are there which infects newborn, child, and adults. They are as in newborns, another organism known as Streptococcus enterobacteriaceae, and in children with more than 4 years of age, it's Streptococci H influenzae. In adults, another one is Streptococcus enterobacteriaceae. Now, the acute hematogenous osteomyelitis, the complications, it includes septic arthritis, growth disturbance, chronic osteomyelitis, and also acute pyogenic arthritis and pathological fractures due to the weakness of the bone at the site of infection. These are the main complications. And now, in cases of post-traumatic and post-operative osteomyelitis, infected open fracture could be the cause, and this is the usual cause. Infected open fracture cause, this is the usual cause in adults, not in children. Okay, and post-operative infections main predisposing factors: debility, chronic disease, previous infection, any steroid therapy, or any long operation which has been going on from some time, any use of foreign material which has infected the site. And the clinical findings we'll found is fever, pain and swelling over fracture site, wound is inflamed, and one particular thing is discharge is noted. Laboratory findings for this is leukocytosis, elevated ESR and CRP. This is also for the acute hematogenous. And now positive cultures. Also, the treatment is also kind of same. It's the surgical treatment, debridement of the site, and use of antibiotic. Now coming on to subacute osteomyelitis. It is mainly due to partially treated acute osteomyelitis, infection of fracture hematoma. It can cause the physis. Okay, commonly affects femur or tibia, the most commonly affected bones. The clinical findings we'll find are painful, limp, okay, no systemic or even local sign or symptoms. Okay, in radiographic findings we'll found it may mimic tumor of the bones. Brody's abscess, localized radiolucency, usually in the metaphysis of the bone. Now, in lab findings, we'll found WBC count and cultures may be normal, but ESR will be elevated. On treatment point of view, surgical curettage and debridement, and antibiotics are carried on for 6 weeks. And now coming to chronic osteomyelitis. These are mainly due to inappropriately treated acute osteomyelitis, trauma, accident, it could be accidental or surgical, and soft tissue spread. Another cause is epidermoid carcinoma. Fistulous tracts may develop into these, and which may cause into chronic osteomyelitis. Common organisms causing this chronic osteomyelitis are Pseudomonas, which are mainly associated with drug abusers, especially intravenous drug abusers. They are mainly got this Pseudomonas infection. And now Staphylococcus aureus, as told earlier, and some anaerobes are common organisms for this, causing this chronic osteomyelitis. Also noted one is Salmonella. It mainly affects the persons with sickle cell anemia. Now, the clinical findings of chronic osteomyelitis. It's mainly the draining sinuses, periods of quiescence and acute exacerbations, flare-ups, pain, pyrexia, redness and tenderness during exacerbation. Radiographic findings would be normally sequestrum, involucrum, and after that the lab findings. They will be normal. Most cases they will be normal unless in an acute exacerbation. Okay, and to the treatment point of view, it will be surgical debridement, intravenous antibiotics based on cultures, and coverage of soft tissue defects. This is important. And if the infection has gone to a deeper levels, the last option available is amputations. Now, complication of chronic osteomyelitis. In an acute exacerbation, growth abnormalities will be there, and pathological fractures, joint stiffness, sinus tract malignancy, amyloidosis. Okay. Now we have covered the most basic osteomyelitis types: acute, chronic, and subacute. Now there are some other forms of osteomyelitis as well. We'll discuss them. Now another one is gas osteomyelitis. Okay, this is a sclerosing non-suppurative chronic osteomyelitis. It may begin with acute local pain, pyrexia, and swelling. The pyrexia and pain subside, but the fusiform osseous enlargement persists. There is tenderness and deep palpation. There is no discharging sinuses. The shaft of the femur or tibia are the most commonly affected sites of this gas osteomyelitis. Now, another one is Brody's abscess. It is a special type of osteomyelitis in which the body's defense mechanisms have been able to contain the infection so as to create a chronic bone abscess containing pus or jelly-like granulation tissue surrounded by a zone of sclerosis. The clinical features of this would be the patient is usually between 11 to 20 years of age. The upper end of tibia and lower end of femur are the most common affected bones of this. It is usually located at the metaphysis of the bone. Now, a deep boring pain is predominant symptom. It may become worse at night, which could, we can say, uh, show to or replicate any cancerous origin of pain. In some instances, it becomes worse on walking and is relieved by rest. Now, another one is biogenic arthritis, or sometimes you can say septic arthritis. The definition of this is it causes through the joint infection. Okay, the infection of uh, joint infection, the organism is carried to the site of infection through blood. Okay, it most commonly affects infants and children. In adults, it may be seen in the person suffering from rheumatoid arthritis, intravenous drug abusers, we have discussed earlier, due to Pseudomonas organism, and uh, one more or one more group, people who are suffering from STDs, and it's also known as gonococcal arthritis. Now, the modes of transmission would be hematogenous through blood, locally spread from osteomyelitis sites, and the main sites are proximal femur, proximal humerus, radial neck, and distal fibula. Okay, puncture wounds and open wounds. This pyogenic arthritis or septic arthritis, it's it it can be it can occur in vast age groups. Okay, it can occur in a 3-month-old child to an adult who has had joint replacement surgery. The main causative agents are organisms are Staphylococcus aureus, Enterobacteriaceae, H. influenzae, Streptococci, and group A Streptococci, Pseudomonas. These are the main organisms which causes this. Now, for clinical findings of septic arthritis or pyogenic arthritis, it's red hot swollen joints, acute pain, fever and chills, and constitutional signs and symptoms of any infection. In radiographic findings, we'll find whitening of joint spaces, soft tissue swelling. In laboratory findings, we'll find elevated WBC, elevated ESR, elevated CRP, blood cultures will be positive, and also one more thing, synovial fluid analysis was also done. Okay. Now, for treatment, the surgical drainage is done or open drainage. Okay, antibiotics are given, and in some cases, splinting of the joint. Now, complications do occur in this case, and these are dislocations, destruction of epiphysis, and ankylosis of the joints. The septic arthritis or pyogenic arthritis that occur in infants is also known as Tom Smith arthritis. Okay, this septic arthritis is mainly seen in the hip of infants. Head of femur is cartilaginous and is rapidly and completely destroyed by this pyogenic process. Onset is acute and rapid abscess formation also occurs. The affected leg becomes shorter and hip movements are increased in all directions. Because of the head is destroyed, now the range of motion is increased significantly. Okay. Clinically, this condition also resembles CDH, congenital dislocation of hip. Okay. Arthroscopic wound lavage is an effective, minimally invasive method in infants, which can be used for clearing up the joint. Okay. Now, another major cause of this type of arthritis, infectious disorders, is tubercular arthritis. It is mainly caused by Mycobacterium tuberculosis. Joint is involved by hematogenous spread, and the other organs involved are lungs and intestines. It's a chronic inflammatory process. In this tubercular arthritis, spine and lower extremities are usually involved. Clinical findings of tubercular arthritis, there would be swollen joints and painful also. Muscle wasting would be there, limitation of movement, may have constitutional signs of TB also. Later stiffed and deformed joints would be present. Now for the laboratory findings, there would be positive Mantoux test and elevated ESR. Synovial fluid analysis would reveal AFBs, rice bodies, and positive culture. On the radiographic finding point of view, we would found subchondral osteoporosis, cystic changes, joint space narrowing. The treatment would include anti-TB medications for 6 to 12 months, debridement, rest, traction, and insplantage according to the joint involved. Now, TB of the spine. The most common site of this skeletal TB is spine, also known as Pott's disease. The pathology would be blood-borne infection, vertebral body involved, destruction and cessation of necrosis, and it will spread to disc space and next vertebra also, continuous adjacent vertebra. Okay, vertebral bodies will collapse due to this infection, and also a cold abscess forms. It's a we can see mainly characterized by this. On clinical findings, we'll find long-standing history of poor health, backache, abscess, neurologic deficits would be present, kyphosis, tenderness, and muscle spasm also. On radiographic findings, we'll see paravertebral abscess, collapse of vertebra, and deformity would be